To check the life back ECG monitor, press on to turn it on. Next, press advisory.
Connect
And then
electrodes.
select yes into manual mode. To perform the test, press options and then select user test. The system will now perform the user test. Whilst it's doing that, I'll make sure that all the gear is present. Making sure that here we have the ETCO2, we have the 3-lead ECG, have the SPO2, and the blood pressure cuff. In this pocket, we have the defib pads attached and ready, as well as aspirin GTN and a razor, making sure the medications are injected. In the back, making sure that there is spare paper and spare defib pads, as well as ECG box. Checking to make sure that the battery is sufficient. Here we have full battery for both of the batteries. Now, whilst it's still completing the test, I will demonstrate how to attach the leads for 3-lead ECG. It's completed the test and it printed, which means the printer is working, and there's paper that says user test passed. Double checking to make sure that there is enough paper in here. Yes, there is. Great. In order to use the ECG, attach a lead that says LA to the left arm area, about here. The lead that says RA to the right arm area, around there. The one that says LL to the left leg area, around here. And the one that says RL to the right leg area, around here. Once the leads have been attached, to press the lead, and then you can select which leads you want to be displayed and which displays you want. To change the size of the ECG leads display, press size, and then you can select the size of the ECG lead display. To change the volume of the heart rate monitor, press options, and then select alarm volume, and then you can turn the volume up or down. Now, I will now demonstrate how to test the shock. To do this, I will use the test load and connect it to the defib terminal. Next, press energy select. In this case, I will just select 50 joules. Then press charge. Wait for it to charge, and then press shock. Now to dump a shock, press energy select. Again, I'll choose 50 joules. Press charge, and at any time or now, press to select the knob. This will disarm and dump the shock. Now, to go into AED mode, press analyze.
Analyzing now. Stand clear. Connect electrodes.
The electrodes connected. To check the first response kit, in this pocket we have the vitals measuring equipment, for example the stethoscope, pediatric blood pressure cuff, adult blood pressure cuff, pupil torch, clothing shears, thermometer, blood glucose test and test strips, making sure that they're all present. In this pocket we have the emesis bags, in ethyl chloride, Sivco lanyards, In this pocket, we have the blood glucose pocket with 10% glucose solution, fluid set, glucagon, and oral glucose. This pocket, the trauma pocket, making sure that there's sufficient bandages, crepe bandages, scary strips, 2 combat application tourniquets, and saline. In this pocket, making sure that the methoxyfluorine, ibuprofen, paracetamol, tramadol, the medications are all in date. This pocket is the airway pocket, making sure that there's a biohazard bag, the OPAs, MPAs, and lubricant, as well as a laryngoscope with the 2 different sizes, as well as a McGill's forceps. The nebulizer mask pocket with oxygen tubing and the nebulizer masks. And here we have the asthma pocket with the salbutamol, adrenaline, and ipratropium. This is the adult resource pocket with the BBNs, masks, and oxygen tubing. Likewise, the pediatric version with the pediatric size bag valve masks and oxygen tubing, and PEEP for both of these as well. And here, the LNA pocket with the different sizes of LNAs, as well as Cox connectors and Thomas tube holders. The IV roll with an assortment of needles and syringes. A sharps container, 2 cardboard slings, slippery Sam. Also have in here a collar and saline. To test the suction unit, occlude the pipe, hold down the test button and turn on to full. The unit will now perform its test. Once it's finished, it will turn off automatically. Great. This unit has passed the test. Suction is indicated for removing foreign bodies from the oropharynx. I'll now demonstrate how to use suction. First, have the patient in the lateral position to remove the bulk of the fluid. Next, suction in a circular motion on the way out. Insert only as far as you can see. Suction for no longer than 10 seconds at a time. Complications of suction include inducing vomiting and raising intracranial pressure. It can also trigger bradycardia via vagal nerve stimulation. Finally, the rigid catheter can cause soft tissue damage and laryngospasm. To check the oxygen, identify the oxygen cylinder, which is a white cylinder with a white shoulder and an oxygen label. Check the regulator by removing and checking the Botox seal. Attach your regulator to the oxygen bottle by lining up the prongs and tightening the screw. Turn the regulator on and make sure that there is sufficient oxygen in the bottle, usually when the indicator is at the green region or about 2000 psi. Next, check the different flow rates to make sure that they all work. Oxygen is indicated for patients with saturations of under 94% on air, except those that are high risk, which include those that are morbidly obese, have COPD, or on home oxygen therapy. Some indications for oxygen include shock, trauma, respiratory distress, and carbon monoxide poisoning. I will now demonstrate how to administer oxygen with this high concentration mask. High concentration mask takes a flow rate of between 10 to 15 liters per minute. First, attach oxygen tubing to the mask and attach the other end to the regulator. I'll now select 15 liters per minute. Ensure that the reservoir has filled before attaching to the patient. Now that the reservoir has filled, I will now attach it to this patient. Ensure that there is a snug fit. Once you have finished using the oxygen, remove the mask from the patient. Turn off the regulator and make sure to bleed the regulator after use. This is to ensure that there is no oxygen left in the regulator. Tristan and myself have been put out to a 65-year-old male who has collapsed and is unconscious. Before approaching the scene, we have made sure it's free of any dangers and hazards, and we have identified a possible escape route. Tristan, are you happy to proceed?
Yes, sir.
Great, let's proceed. Hello, sir. This is Tristan. I'm James. We're from AET. We're here to help. Hello, sir. Can you hear me? No response to verbal. Hello, sir. Can you hear me? No response to pain. Checking the airway to see that it's clear. And checking to see if the patient is breathing for 10 seconds. Listening for sounds of breathing and looking for signs of breathing. Doing this for 10 seconds. He's not breathing. Just could you please start compressions? Yeah, thank you. Whilst Tristan is doing the compressions, I will get the AED.
And call for backup. AED calms patients with cardiac arrest requesting
Going
R50.
to attach the electrodes to the patient as indicated. And turning it on.
Analyzing heart rhythm.
Analyze.
Do not touch the patient.
Whilst it's analyzing, I will connect the bag valve mask to the
Shock
oxygen.
advised.
Shock advised.
Charging.
Charging.
Stay clear
Stay
of patient.
clear.
Deliver shock now.
Clear.
Press the
Shocking.
orange button. Shock
Great.
delivered.
Back on compressions, please, Tristan.
Pause. Start
Going to
CPR.
turn into 15 liters per minute. Tristan, good compressions by the way, and could you please start counting at 25 compressions? Thank you.
Now, 5, 6, 7, 8, 9, 10.
Making sure that good chest rise with a C grip, ensuring a good seal to the face. Because the patient is unconscious, I'm going to insert some airway adjuncts. I'm going to insert an OPA measuring from the tip of the ear to the corner of the mouth. Thank you. Good chest rise, good chest rise. Good compressions by the way. Inserting and rotating 180 degrees. With the MPA, again from the tip of the ear to the top of the nose. Trying to make sure it's lubricated.
8, 9, 10.
Thank you. Good chest rise, good chest rise. Could you please go deeper on the compressions? Thank you, Tristan. The speed is pretty good. Yeah. Making sure that it's lubricated and inserting into the nasal cavity.
5, 6, 7, 8, 9, 10.
Thank you. Good chest rise, good chest rise. Beat bad health masks are indicated for patients with a GCS of less than 6 and who cannot breathe on their own. Complications can include overinflation leading to lung tissue damage.
6, 7, 8, 9, 10.
Good chest rise, good chest rise. With the bad health mask, making sure to have a good seal on the face of a C grip.
At this point, I would speak with the patient's wife who is present and ask her about the patient's relevant medical and surgical history, as well as any allergies, noting all this down.
Stop
Stop
CPR.
CPR. Right, could we please stop?
Analyzing heart rhythm.
I'll do compressions, thank you.
Stay clear of patient.
Thank you.
Analyzing heart rhythm. No shock advised.
Shock advised.
Pause.
Could
If
you please
needed,
count my
start
compressions,
CPR.
Tristan?
9, 10,
Thank you.
11, 12, 13, 14, 15, 16, 17, 18,
OPAs and MPAs are indicated for
5,
patients
6, 7, 8, 9, 10.
that cannot maintain a patent airway because of a reduced GCS. Complications of OPAs include soft tissue damage to the oropharynx and
5, 6, 7, 8, 9, 10.
complications for MPAs include damage to the nasal cavity. OPAs can also induce vomiting by stimulating the gag reflex.
24, 25, 26, 27, 28, 29, 30.
MPAs are often used when OPAs cannot be used. For example, the patient is conscious or have a increased GCX.
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
We will continue this until the patient has a return of spontaneous circulation, or until backup arrives.
2, 3, 4, 5, 6, 7, 28, 29, 30.
We will continue like this and swap positions for compressions and ventilation to ensure we do not get tired
1, 2,
and the quality of compressions are maintained.
30.
Backup has arrived.